A warm good afternoon to everyone present here. To A warm good afternoon to everyone present here. Today we have gathered for a guest lecture on highlights of recent NMC guidelines in postgraduate training program for MD in Pharmacology. The speaker for today's guest lecture is Professor C M Kamaal sir. Today's guest lecture will take place under the moderation of Professor Amod Kumar Sachan sir, Professor and Head Department of Pharmacology at KGMU Lucknow, and Professor R.K. Dixit sir, Professor, Department of Pharmacology at KGMU Lucknow. I now invite Professor Sarvesh Singh sir to kindly welcome Dr. C M Kamaal sir for flower welcome. Thank you, sir. I would now request Professor Amod Kumar Sachan sir and Professor R.K. Dixit sir to take the chair at the moderator table. I request Professor R.K. Dixit sir to kindly address the proceedings.
Thank you. Good afternoon, everyone. Throughout my life, I have learned only two things. One is change is the constant, and the second is that whosoever can adapt is actually the human. And we are human, we have to adapt. These two things are the crux of the CBME curriculum. Number one, because of CBME curriculum, number of changes are there. And all these changes have been devised by many faculties, and all these have been they have been framed in a such a way that most of the clinical things and most of the pharmacologists they are they become more they have more touch towards the clinical side. So first thing is there, because there is change, so we have to adapt. The second is we have to adapt, and for that we have to actually know what are the changes. And for that we are fortunate that we have eminent pharmacologists of India, national coordinator of a very renowned scientific association in India, and HOD of pharmacology from GMC Saharanpur, Professor C M Kamaal. So I'll give mic to Professor Amod Sachan sir to introduce Dr. C M Kamaal sir.
Good afternoon. It's my pleasure to introduce Professor C M Kamaal, who is a renowned pharmacologist and working as a professor and head in Department of Pharmacology at Government Medical College, Saharanpur. He is a unique personality who is pharmacologist as well as clinician. He has done MBBS and DCH, and subsequently he has done MD in pharmacology. He is a practicing pediatrician beside a pharmacologist. He has got more than 15 years experience in the field of pharmacology and in the field of pediatrics and neonatology. His academic accomplishments are many. Few of them I would like to tell you. His experience of working in academics and pediatric practice for a very long time, worked as a clinical research physician, creating a single platform for MD pharmacologists, popularly known as NMDP, dedicated and continuing his mission. He is very fond of this thing, and practically speaking, I can see that he has dedicated his life for the development and progress of pharmacology in India. Former Director and Founder, Department of Clinical Research, Sharda University Hospital, Greater Noida. Founder and Head, Department of Pharmacology, SMMH, Government Medical College, Saharanpur. noted pediatric pharmacologist and author of book Drug Therapy in Pediatrics, represented country at an International Pediatrics Pharmacology Symposium organized by IUPHR, and Secretary in the Institutional Ethics Committee of the Government Medical College Saharanpur, certified GCP trainer, certified trainer in medical education, and certified UG and PG teacher. He has established a wonderful, beautiful skill lab for a practical pharmacology in Department of Pharmacology, first in the state according to CBME curriculum. He has been widely acclaimed for his work all over the country, and the most important thing about his personality that is so much dedicated for the development of pharmacology that he is going everywhere, whether it is the state or the central government. Yesterday, he has talked with the Central Minister of Health and Family Welfare, Mr. Mansukh Mandavia, and he has invited him just to tell about the development of pharmacology in the country and what better he can do for the pharmacology. I'm really have a great pleasure to invite Dr. C M Kamaal for this program of highlight of this CBME program. Welcome, Dr. C M Kamaal. Please take your podium and give insight about this development.
Audible? So this platform we have created for the future of the pharmacologist. I believe the future of pharmacologist lies in you. You are the future of the pharmacology, and I believe the pharmacology is one of the most important specialty in the clinical sciences, and you will believe that it is a bridge in preclinical, paraclinical and clinical subjects. If we are talking about the specialty only, pharmacology specialty only, then you will also agree with me that we are a complete specialty. If we are comparing with anatomy, anatomy is not the complete. Physiology, biochemistry, pathology, even pathologists are only aware of the pathogenesis of the disease. They cannot treat a patient. Microbiologists also, they cannot treat a patient. But pharmacologists, being a complete degree, we have to study anatomy, we have to study physiology, biochemistry, each and everything we need to know. And of course, drug development process and each and everything about the drug we know. So pharmacologists can also be a very good physician, and in my own life I have seen hundreds of the pharmacologists who are successfully running private practice also or practice also, and they are earning like anything. I'm not telling that all the pharmacologists should go to practice, but we should keep all the avenues open for us. Okay, we should not think that our job is limited to academics. Of course, academic is one of the main area of the attraction for the pharmacologist, then pharmaceutical industry also. Okay, so with these words I will be coming to my topic, and again I would like to know share with you all that I am a very ordinary person, and I have established this organization with the blessings of all senior faculty members of the country, and they all are cooperating. Fortunately, I am getting the support, love and affection our future generation for the pharmacologist, MD Pharmacology. And today with this podium, I am announcing that through NMDP, it is the only body On the WhatsApp only, we are connected to 2,500 MD Pharmacology postgraduate and teacher and faculty members. Many of our efforts have been recognized, and we are at very fast pace. We are crossing the various steps. We have successfully organized NAPTICON. That is the first national conference of the organization, successfully organized in Karnataka, Mangalore, where more than 450 pharmacologists have participated, and probably you all are aware, on our request, Dr. Sachan sir have taken, along with all the colleagues of the department, have taken to organize the next NAPTICON in Lucknow. And many of our other activities are also going on simultaneously, side by side. We are coming up with the national journal, our own journal, National Journal of Pharmacology and Therapeutics, and we have chosen best of the publisher for that. So with this introduction of our behind activity of organization and NMDP movement, the movement motto is only that we have to unite each and every pharmacologist of this country on a single platform. So I am continuing with my talk. We will be discussing the highlights of recent NMC guidelines in PG training program for MD in pharmacology. Before I can go ahead, I'm showing you a video related to the NAPTICON, upcoming NAPTICON. Again, with this video, I am congratulating you all because you are the workforce behind our dreams, upcoming NAPTICON. And on the behalf of National Association of Pharmacology and Therapeutics, I would like to express my sincere gratitude to the organizing chairperson, Dr. Sachan sir, the motivating force behind all the time, Dikshit sir, and organizing secretary, Dr. Sharvesh sir. So with these words, I am coming up to my presentation. Relevance. We will be discussing relevance of recent NMC guidelines in the current scenario, teaching and learning methods that have been proposed by National Medical Commission for MD Pharmacology postgraduates. Then method of assessments, you probably are aware of that recently teaching methods as well as method of assessments has been changed as per the competency based medical curriculum. So first guidelines came last year, CBME based guidelines, then a recent document has come up in the August last year. And according to that, I have prepared this presentation on the basis of the recent guidelines that have been issued by National Medical Commission, New Delhi, in the month of August last year. Then if we find some time, we will be discussing the most difficult and most important part of the pharmacology, that correlation of the pharmacology specialty with the bedside, direct touch with the patient. Unless and until we will not be involving direct with the patient, we cannot as K.D. Tripathi sir, whom we have given the Lifetime Achievement Award in Nepticon, he has also expressed his words that it is responsibility lies on us. It is us who has to prove importance. People will take our importance once we will be involved in proving our own importance. So, relevance of the current NMC guidelines is first question that is arising in all the minds of pharmacologists or in your brains also, that are our MD training programs adequate for the student, satisfying their future career? Now, many future careers are available to us after postgraduate degree of the pharmacology, and you will agree with me that medical sciences is changing on weekly basis, and we need to give answer to this question: are we changing our training with the time and demand? Maybe we need to think of seriously. Even these are saying that it is the time to upgrade. Okay, so we need to think that it is time to upgrade through, as Dikshit sir has told, that the change is the best thing, and with the change, it is the law of the nature, that with the change, we need to have an insight on the careers after MD Pharmacology. So there are 6 steps in developing an MD Pharmacology curriculum. First, we need to identify the problem. Then we need to target need and assessment. We need to decide goals and objective. Then we need to devise the educational strategies that we have to follow. Then after devising these educational strategies, we need to implement all these strategies, and then we need to evaluate, and this cycle is going on. So, as per the NMC recent guidelines, the requisite of all MD students joining the postgraduate courses, they are supposed to work as full-time junior resident in the department during their period of training. This is as per the definition that has been given in the official document, and it is telling that attendance not less than 80% of the training activity during the calendar year, and participating in all the assignments and facets of the educational process. Then maintenance of the logbook for recording the training by they have undergone, and details of all the procedures, all the laboratory and clinical postings in the real-time setting in this logbook. So if we, the subject-based learning objectives that as per the NMC guidelines have been divided in 3 parts: cognitive part, affective part, and of course, psychomotor part. While the cognitive domain is covering the general topics of general pharmacology, systemic pharmacology, and research-related things, there is a list that have been given. You can go through that. All the details are available on that document. I will not be going, otherwise the talk will become very lengthy. Then there are the affective domains. Affective domains related to the adverse drug reactions, rational use of the medications. Then medication adherence is very, very important problem on the follow-up, because many of the patients, they do not complete the course of the medications they have been prescribed. Drug interactions, awareness about the generic drugs, and interactions with the patient, healthcare and professional. It is very, very important because in the competency-based medical curriculum, a lot of stress is being given on the communication skills also. How we are communicating with the patients. So that patient all the time should adhere what have been prescribed to during the course of the treatment. In the psychomotor domain, that can be done in independent or as a part of the team, or interpretation sometimes of the result is required. They have divided it in the two categories now, mandatory categories and desirable. Some things that previously were falling in the mandatory category, they are now falling in the desirable category. I will be showing you in the coming slide. So this is the psychomotor domain, mandatory. Quickly going through the list: ADR, casualty assessment, prescription, analysis, audit. Might be you are already doing all these exercises or related work in your department. This is just a revision. Use of the equipments, analgesiometer, physiograph, or ECG. Among all these, I find ECG is very, very important because many of the pharmacologists are being appointed in the clinical research area or pharmaceutical industry. They are being appointed as a clinical research physician. I myself have worked as a clinical research physician in Manipal, Equinova, where a doctor needs to do BA/BE studies, and he needs to work in a setup of ICU, okay, where the drugs are being first injected to the humans. And ECG setting, so as per the recent guidelines, ECG is a very, very important tool, and every pharmacologist must be basically aware of the reading, basic aspect of the ECG, and identify the emergency conditions that can arise through the reading of the ECG. Then preparing the drug solution, determining EC50, ED50, drug dosage calculation, interpretation, dosage, response curve, interpretations of the pharmacokinetic data are also very, very important. And presentation in classroom, in clinical meetings is also has been prescribed by recent NMC guidelines. Then probably are all involved with the critical appraisal of the research paper. Only research paper need not to be presented. We need to present a critical appraisal of the research paper. That is more important. Preparing the document related to the clinical trials, informed consent form, protocol writing, evaluation of the drug promotional literature. When we are talking about the drug promotional literature, exercises that are being given to the undergraduate are different, and to postgraduate we are making it little bit complex. Say for example, in clinical settings also we are, undergraduate students are being given small and easy cases, then postgraduate are little bit difficult cases. Preparing document related to the pharma industry, very, very important. Package insert, you need to prepare, and you need to know how to prepare a package insert that is being found inside the any drug package. Then clinical pharmacology exercise, memory, psychomotor, the exercises related to the central nervous system, cardiovascular and respiratory, exercises related to the therapeutic drug monitoring, exercises related to antibiotic stewardship, and preparing document, standard operating procedure related to technique used in pharmacology, research, clinical trials, route of the drug administration under the simulation. These can be performed in the simulation lab on the mannequins, because mannequins have been made mandatory in almost all the institutions as per the recent competency-based medical education curriculum. Then writing skills for scientific publication, very, very important. Research projects by the funding agencies. So communication skills and writing skills are forming a very, very important area where all postgraduate MD students must develop all these skills thoroughly. Because anywhere we are going, if we are, even we are in the academic area, even if we are in the pharmaceutical industry or clinical research, we have to need to do a lot of communication through writing and through oral communications also. Then skills related to the scientific writing. Then as per the recent NMC guidelines, PG book is must. Every postgraduate student need maintain a PG logbook, which will be providing a feedback and a continuous assessment of the process of learning by the postgraduate MD pharmacologist. And PG students shall be trained to reflect and record their reflection in the PG logbook. So reflection is very, very important, because reflection gives us a lot of opportunity to learn, and it is a continuous process. Logbook in original to be produced at the time of the final practical examination, and a proficiency certificate from the head of the department can be generated, and it should be inserted in the logbook as per the recent guideline. Logbook should be used in the internal assessment of the student, and logbook should be checked and assessed periodically by the faculty members. And all faculty members of the department should be involved in checking, in assessing the students of postgraduate pharmacology. It is not that one postgraduate teacher is being assigned and he is only all the time is involved with the patient. It has been given clear-cut guidelines by recent NMC guidelines that all the teachers of the department should be involved in this. All logbook entry must be done in real-time setting. So what is the change? Logbook was also existing previously. It is continuing as such, but it is in much more refined form. And almost all the guidelines have been in black and white. What needs to be done? What are the requirement as per the recent NMC guidelines? So record in the PG book is details and duration of the posting. Posting, if a student is completing posting in the ward, OPD, casualty, then various procedures assisted or performed during the postgraduate period. Then details of the presentations. Throughout the years, students are involved in giving seminar, symposium. All the details of each seminar and symposium, along with the reflections by the student, needs to be mentioned in the PG logbook. Details of the teaching and training session that have been attended by the students, number of the conferences, symposia, paper presented, all the details should be in the PG logbook. Then the details of the acquisition of the various competencies that have been defined by the National Medical Commission should be mentioned. Students shall be trained to reflect and record their reflection in the logbook. If we are talking about the exposure to the seminar or symposium or conference, the current NMC recommendations are saying that trainees should attend accredited scientific sessions, meeting in the form of the CME, continuing medical education, symposia, conferences, at least once in a year. Okay, this is mandatory now. And at least 3 sessions, such kind of 3 sessions during their entire postgraduate course are being prescribed by the National Medical Commission. And current NMC guidelines, because there are a lot of queries by postgraduate students, we are directly in touch through WhatsApp group. Many students are sending me the message related to this. There are a lot of queries. Now, clear-cut guideline by the NMC related to the paper and poster presentation and related to the publication, which is saying that at least 2 presentations at the national level conference should be there. And there is a good opportunity in Nepticon. In last Nepticon, Mangalore, I'm happy to announce from here that more than 200 papers have been presented and published during the entire session of the Nepticon. And 1 research paper should be published and accepted in index journal. These were not mandatory requirement previously, but now NMC have made these requirements. and it is suggested that the local or the university review committee can be involved to assess the work sent for the purpose of publication. Also, this is the new thing, training of the PGs in ACLS and basic life support. We are having, Dr. Sarvesh sir have given me the opportunity to visit the simulation center here. Excellent simulation center at King George Medical University. And these trainings have been made compulsory by National Medical Commission. Dikshit sir is a part of the committee of NMC committee officially framed. He is a member of that. And many of members during the talk they have told me that initially probably they have prepared these guidelines for the MD Pharmacology, and these guidelines have been so much so liked by the NMC members that they have made it mandatory for all the specialties. And this is must that students should learn basic life support and advanced cardiac life support. As a doctor, all the time we must be ready for saving the life. You are you will be agree with me that in paper, in news, in TV, we are going through the news that a doctor was present at there during the time of the cardiac arrest. Person collapsed during a seminar or during journey, and doctor was able to survive life, to survive the patient. I myself have a very kind of the experience related to that. Last year I was traveling to Dubai. On that flight, a person has collapsed, and then the air hostess has told me that any doctor is available. So I told yes, I am available. I immediately provided resuscitation, and with the blessings of the God, patient survived. So we need, as a doctor, we need to prepare all the time with the emergency. We cannot leave it there, cannot give the excuse that we are the pharmacologists, we don't know how to resuscitate a patient. It is mandatory now. Then competency, computer and internet training for the PG is must. Then many of the postgraduate students will tell me that many of them are having the laptop, they are quite proficient with making PowerPoint presentation, with working on the MS Word, Excel sheets and all. No, it is not that. I am talking about the professional training of the, at least MS Word, PowerPoint presentation and Excel. And for each and everything there are at a very nominal prices in the market. Trainers are available who are giving the training for a period of 15 days, ranging 15 days to 30 days. And that can be attended part-time in the evening hours. See, there will be a lot of difference preparing a PowerPoint presentation and preparing a PowerPoint presentation by an expert. What we are preparing for our teaching purpose, we are not doing it professionally. We need to learn it professionally. And internet and the other gadgets learning is also very, very important, because you will agree with me that all the times we are having our smartphone with us and we are taking the help. Okay, we are taking the help of the smartphone. And with these smartphones, many clinicians, they are not going through the book. If I need to find the dosage of the vancomycin that I need to give to neonate, immediately I am searching on this. So this is a companion. So we need to adopt, whether this is smartphone, whether this is computer or laptop, training related to the various apps that are very useful. We need to professionally train students. We need to identify what are the various needs of the clinicians or students or our future leaders, and we need to train accordingly. We need to modify us. So professional training of the gadgets, smartphones, laptop, computers is very much needed. Going through the Google search is also, we need to learn how we can compare it with the PubMed, how to search an important. Professionally searching of Google and PubMed is quite different. What we are searching in ordinary, there are a lot of, there are the now well-defined sessions related to that. and professionals are available that are giving related to these kind of the training. That good clinical practice training is must now by every student, and each and every students are supposed to be trained in GCP training, good clinical practice related to bioethics in clinical trials, and a certificate should be there. Fortunately, through our platform, we are organizing GCP workshop every year. Last year we have organized, we have got tremendous support and response for our workshop. We were expecting only 300 the registration, and it has crossed more than 500. We have to close registrations. Again, GCP workshop is coming by National Association of Pharmacology and Therapeutics. It is online very easily at a very nominal price, and you can get trained online by expert in the GCP. We are taking the experts from various institutions, top institutions and top experts of the related to subject we are taking. Similar is true with our competency-based medical education series. It is also running very successfully. We have organized almost 3 sessions like this very successfully online. And all these now have been made mandatory by the National Medical Commission. There are a lot of queries to the animal experimentation. Initially, animal experimentation in the previous document was in the mandatory list. Now, if we are comparing, it is in the desirable list. Means, if we can replace the animal study with the computer-assisted simulation or model, that is also enough for the postgraduate student. It is well and good if the institution are having animal house, they can give them the exposure, little bit exposure of the animal handling also and animal related experiment. But these are not mandatory now. If the students are interested, my personal opinion is if animal house and facilities are there, students can be given a training, can be introduced, but exhaustive training is not mandatory like initially, that in initial days we have to sacrifice the dog, we have to make lot of exhaustive biopsy. They have been withdrawn, and we can do it very easily by the computer related simulation facilities. Other experiments can be performed as permissible by the committee for the purpose of control and supervision, that is known as CPC guidelines. Then I have already discussed this. I am coming to the teaching learning method for the MD Pharmacology students. Some of the teaching learning methods maybe you are already following in this department also at KGMU. Many of you are attending the demonstrations or giving the demonstration to the undergraduate students. You might be presenting symposia. You might be covering the journal club. I'm not aware where clinical meetings are being attended by the postgraduate students in another department. It has been suggested by the MD Pharmacology students. Then seminar, small group discussions we are all doing in our institutions separately all over the country. This is the core area, bedside teaching, and we are developing various modules. We are working exhaustively day and night with the experts. We are developing module, and soon we will be able to take all the postgraduate MD Pharmacology students to the ward by the bedside, where we will be able to teach you pharmacology, and where we will be able to correlate pharmacology with the therapeutics and treatment options. Then case-based learning is also important. A particular case be taken from the ward, and this case can be presented in the department. You can use images also if you cannot reproduce the patient. In clinical department, they are taking the patient from the ward, they are coming with the patient as we used to do in our department, clinical department. If it is not permitted, then you can use the images also. You can use the case sheets and various drugs that are being used for the purpose of discussion. Then simulation-based teaching, I have already discussed that it is must, and there is a lot of stress nowadays being given to the self-directed learning. And there's a lot of time needs to be devoted, because as a a doctor, as a doctor, we are agree that we are the lifelong learner, and it will be good if all the time we can be remain, if we can remain a student all the time, because we must be prepared all the time, and it is good to be in the learning phase all the time. Then interdepartmental meeting can also be organized in conjunction with the pharmacology, like pharmacology, pediatrics, pathology, microbiology, uh, joint meeting together, and there are a lot of learning opportunities. And these teaching learning methods, those were the only the subject of the discussions are now in black and white. They have been given by. Then PG lectures, didactic lectures should be used sparingly. A minimum 10 lectures are recommended nowadays per year in concerned department. They have also suggested topic of the various lectures. I am not going into the much details of that due to the paucity of the time. Then the journal club, minimum once in 1 or 2 weeks is suggested. Topic can include the presentation and related critical appraisal of the original research published in peer-reviewed or indexed journals. The presenters should be assessed by the faculty members, and faculty members can also use the various grades that can be given to the patient during the assessment. Then seminar guidelines are given that minimum every 1 or 2 weeks, once seminar is being should be organized. Important topics should be selected as per the subject requirement and allotted for in-depth study by the postgraduate student. A teacher should be allocated for each seminar by as a faculty moderator. A faculty moderator should help student to prepare that particular topic for the seminar. It should be comprehensive evidence-based review of the topic, and student can be graded by the faculty members. Thank you. Then student symposium minimum once every 3 months. Broad topic significant should be selected, and it can also be assessed by the faculty members like seminar. Then same is true with the laboratory work, bedside clinic minimum once every 1 or 2 weeks. Laboratory work, clinical teaching, bedside teaching should be coordinated and guided by the faculty member from the pharmacology department. Various methods can be adopted like DOP, demonstrate, observe, assist and perform, simulation in the skill lab, and case-based discussion, etc. that can be used. And faculty from the department should participate in moderating the teaching learning session during the clinical rounds. I have already given you the insight of the interdepartmental participation or colloquium. Faculty student must attend monthly meeting between the Department of Pharmacology with the other department. It is in the recent suggestion. And now rotational clinic, community institutional posting, depending on the local institutional policy and subject specialty, postgraduate training may be posted in relevant department, units and institutions. Sir, these have been started by here. Okay. The aim I require more in-depth knowledge of the applicable to the concerned 2 weeks biochemistry related investigation, 2 weeks anesthesia, 2 weeks dermatology, 1 week medical oncology. If certain kind specialty are available, like KGMU is much developed institution, you can take the advantage of that. And clinical trial research unit and pharmaceutical industry, 2 to 8 weeks training should be made available. That student can be sent directly to the CRO, clinical research organization or pharmaceutical industry, so they can gain a hands-on experience related to what they are supposed to do during their career choice. And medical education and department of medical education posting has been made mandatory nowadays. It was not previously mandatory. But as a postgraduate student, you must be fully aware of the undergraduate curriculum also. And believe me, you will be fully aware what I am presenting today. Each and every slide you must be aware of. It is in the curriculum itself. Means the topic or the presentation of today is also a part of your curriculum. So you must be aware of all these, and you must be, initially what was the thing that was lacking initially, that postgraduate students are not being opportunity to be in the teaching involvement with the undergraduate. It has been opened now. They can be involved in various studies with the UG teaching activities, because ultimately they are the future teachers. So we need to take opportunity, give them the opportunity, and at the most in the initial period, a suggestion can be given that if a senior faculty member is giving a presentation or a topic related to 1 hour, 5 minutes or 10 minutes can be given to the postgraduate student, and then he can assess. During that time, postgraduate student will develop a lot of confidence, and rest part can be covered by the senior faculty member. So taking to the student to the UG teaching is very, very important. Now through medical education unit, they can also be connected to the medical education. Now almost all the medical colleges are having the medical education department or unit separately. So observation what is going on there, and during the course of their symposia and seminars, student can also participate. And PG students shall also conduct UG classes in various courses. I have already discussed this. And faculty needs to be observed, and faculty needs to give feedback related to that. Now there is a course in research methodology. There is a portal, that name is Summative. Sir is talking about this. There is a course that is called BCPR, Basic Course in Biomedical Research. It is the online course. You can register online and you can get it trained. They will call you for a written exam at a particular center. It is not much difficult. Each and every student need to pass this course that is called Basic Course in Biomedical Research. It is being given in conjunction with the Indian Council of Medical Research, New Delhi, and at the completion of the course they are giving you the certificate, and this certificate needs to be printed and that can be inserted in your logbook. Okay, and same is true with your thesis. Initially in thesis work, head of the department are giving you the certificate. After that certificate, this certificate can be inserted in your thesis work, and same is true with the logbook also. So all students, postgraduate students shall complete this online course in research methodology. It has been suggested within 6 months of the commencement of the batch, and certificate should be generated, and I have given you the utilization of the certificate. Then two research projects are different. One research project is related to your thesis work, another is another short research program, and that topic can be separate. Okay. So if your thesis is related to diabetes, you can take a separate means research related work in the medical education department also, or others also, as per your choice. But additional research should be different from the thesis work. It is needed to reinforce diversity of the knowledge and skills. One additional research project started or already should be going on in the department. You can be a part of related to that. And if the thesis on clinical topic, project may be related to the community work, field work, or laboratory work also. These are the suggestions that are being given. Then one important thing needs to come in our mind. If we are giving students this kind of the training, how you are being assessed? Assessment are two types. How many types of the assessment? Can anybody told me? There are two major kind of the assessments. Yes. Formative and summative. What is the formative assessment? What is the formative assessment? And what is the summative assessment? See, formative assessment is the ongoing process. It goes on throughout the training period. Okay? And say for example, you have presented a seminar. Okay? And we have divided that we are giving 4 grades. It is bogus, it is ordinary, it is good, and it is very, very good. So this is a kind of the assessment, and this can be given at the time of your symposium, seminar, or other presentation, or any kind of the research related work. And this is continuing process, and it is going on the around the year. It is different from the assessment that is being taken at the end of your completing of the course. So this is the assessment that is called formative assessment. And then there is a summative assessment. What summative assessment is? When you are completing your thesis work, okay? You have completed the basic aspect in the BCPR cycle research, all the trainings you have obtained, certificate you have generated, and you have completed all the basic criteria of sitting in the exam. Thesis work is completed, is submitted, is accepted, and now you are appearing for the MD Pharmacology exam. Then it is called summative assessment. Okay, you can take it that if I am going to a restaurant, I have given, say for example, a soup. Okay, and I am telling the bearer, I have tasted in a scoop, I have tasted, and I am telling the assessment how it is. What kind of the assessment is this? Summative or formative? It is formative assessment. I am satisfied. Now soup is good. So I can give the other meals also, a full course meal also, and I am taking the enjoyment, and then after enjoying all the food, completing having the food, I am paying the bill. At that time, I am making the assessment of the restaurant, that it is a good restaurant. I can come again. What kind of the assessment it is? It is summative assessment. So please keep in your mind all the time that summative assessment are different from the formative assessment. Quarterly formative assessment have been suggested during the whole pharmacology course, and it should be based on the case presentation, case workup, case handling, management. It should be once a week. Then laboratory performance assessment should be twice a week. Then journal club once a week. Seminar fortnightly. Then case discussion once a month. Interdepartmental seminar once a month. These are the recent guidelines. And if we are coming, the formative assessment should include quarterly. The assessment should be conducted in theory and practical or the clinical examination also. Both areas can be covered. Should cover all the domains of the learning, cognitive domain, psychomotor domain, affective domains, all the domains. It should also cover professionalism and communication skills. All the teachers of the department should be involved in the assessment. I am repeatedly telling you that all the teachers of the pharmacology department should be involved during the process of the assessment. So essential prerequisite for appearing the examination is included. Now it is compulsory. You must complete logbook in original, and that needs to be produced at the time of the final practical examination. It should be signed by the head of the department also, and by the your supervisor also. At least 2 presentations at national conference during the postgraduate period. I have already described it in details. 1 research paper should be published and accepted. These are the essential prerequisites for appearing in the examination, and it is suggested that the local or university review committee can be involved in the firm. Now coming to the summative assessment. Assessment at the end of the training period. Theory examinations should be held in advance. It is suggested before the clinical and practical examinations. Answer book should be assessed and evaluated beforehand. So, before the commencement of the practical or clinical or oral examinations, these must be assessed, answer book. Now your summative assessment or your final MD examinations have been divided in these parts. Thesis part, we are already doing and we are assessing also. This is right from the beginning. Now theory examination, you need to appear. Practical examinations, you need to appear. In the thesis work, writing thesis is a compulsory. It should be used for inculcating research knowledge and skills. My suggestion is if the thesis topic can be related to the clinical case or clinical topic, it gives you an edge that you will be, right from the beginning, you will be well versed with the protocol writing also. And taking the consent issues with the ethical aspect, taking the note from the ethicals committee. So clinical topic should be preferably be given by the students. It gives an edge. All postgraduates shall conduct a research project of sufficient depth to be presented to the university as a postgraduate thesis, and thesis work must be under the supervision of an eligible faculty member of department. And then one or more co-guide can be taken from the same department and from the other departments. Thesis must be submitted at least 6 months before you are appearing for theory and practical clinical examination. Then examined by minimum of 3 examiners, it has to be examined, and 1 internal, 2 external examiners who shall not be the examiners for the theory and clinical examination should assess your thesis work. Then acceptance of this thesis is mandatory. I have already told you to appear for the theory and practical and clinical examination. Then I have already explained you the additional research topic. I will not repeat it. Then theory examinations, you are all aware of that it is held at the end of the 3 academic year, shall be organized on the basis on the grading, or you can assessor can use the marking system also. Obtaining 50% marks as previously are mandatory, still continuing, and it is consists of the paper 1, paper 2, paper 3 and paper 4. But in paper 1 there are the basic sciences and applied pharmacology, systemic pharmacology. 3 is covering clinical pharmacology, experimental research, biostatic and education. This has been added. It was missing previously. So medical education has now been added. It is an officially part and requirement, and questions related to that, medical education, related to assessment, related to teaching learning method and other areas, you may encounter questions in your theory paper also. And there will be definitely a question, maybe in the form of the long or short question. Then 4th paper is based on the recent advances in the pharmacology. Then coming to the most discussed part, practical and examination. This should be spread over the 2 days as of the previous practice. It includes various major components, and it must assess mainly of the psychomotor domain apart from the other domains. This is the outline now being given, and they have given the examples related to that, with each and every category. A student should be given long exercise. We are giving to postgraduate student, we need to give short exercise. OSP probably were not being given in some institution. They are adopting it, but now it is mandatory that OSP and OSCE exercises should be there. Then there are these grand viva and assessment of the presentation skills and teaching skills of the students needs to be checked. during the practical examination of the MD exam. In long exercise, they have given some suggestion. It can be given protocol designing, or case audit can be given. This case audit can be performed in the clinical setting in the ward also, and then perform experiments or simulated experiment as per the postgraduate regulations. Then the short exercise is demonstration of effect of the drug, interpretation of the result in the humans, then demonstration of effect of the drug interpretation in small animals. One can perform rabbit eye experiment through direct involvement of the animal, rabbit, or through the simulation software also. Then interpretation of the result of the previous tracing or table exercise needs to be given. OSCE and OSPI, they have suggested that at least 10 to 15 stations should be developed. And they are much more exhaustive as compared to the UG practical exam. Station should be a mixture of the observer, where the observer present and unobserved. I will also give you an outline related to that. You can take the pics of that, and I will be sharing this presentation to you all on WhatsApp also at the end of the presentation. Then grand viva preferably be conducted by each examiner separately. These are the recent guidelines. And presentations, again, there are two kinds of the presentation. Micro teaching is separate, and then thesis related presentation. So this entire slide in one go is presenting what needs to be given during the practical pharmacology examination. This is the outline I am giving you related to the circuit examination station circuit. This is responsive, again responsive. This is procedure related station. Then a rest station can be given after some gap. Then there is a rotation of the student. Student is going in this direction and coming, and then he is exiting from the hall where OSCE and OSPI exercises are being given. You can give attention to this slide that there is an observer here. There is an observer here. So all the stations observers are not needed. Some of the exercises can also be given without the observer, and that can be assessed by the teachers later on the papers, related to papers. Okay. In the station 6, you can see that there is a communication related exercise. Say for example, we have put the drugs related to the tuberculosis. Then you may be asked during that station how you will be explaining the drug to the patient. How you will ensure that patient will be keep adherence to all the time to this. So this is the examination station circuit, and this is a pictorial view of the previous slide. We have arranged the station like this in our department. Not much costly, but it is very impressive. And summative assessment, the various OSCE, OSPI, even related to OSCE, OSPI, they have given the topics also. They have suggested. I am not going into the details of the various topics. I will give you the presentation. You can go through that. Then last part is the bad side correlation of the pharmacology and therapeutics. And I feel with this small period of time, a separate this is area of discussion, and we are in process of developing blueprint related to that, where soon you will be taken to the wards where your MD exam can be directly taken bad side. And this will, I feel, this will be a dream come true for all pharmacologists of the country. So I'm not going covering the second part, second exposure. I'm just giving you that we have a lot of opportunities of working. Now we can develop if facilities are available, and there are a lot of challenges related to the bedside training because of the overcrowded ward, lack of cooperation by the colleagues and clinical department, disturbance of ward atmosphere by presence of the teaching students, medicine issued by the hospital are sometimes being kept in pharmacy, sometimes it is being kept by the side of the patient, where it is easy to conduct an assessment exam. I do agree, most of our faculty members are not duly trained for it. We need to train ourselves, then we need to train our students also. Then there is some lack of desire by the faculty members. Some are considering is extra work. But there are a lot of opportunities, believe me, maybe in the form of the various developing newer modules for teaching in pharmacology and therapeutics. We need to use thoroughly, we need to develop rational exercises related to pharmacotherapy. Here I am giving the example that in my ward I am giving all the syrup in the desk to the student. I am giving the example that this is the patient come to you. I am giving the syrup in his hand. Which syrup you will take? It gives a lot of difference. Students take a lot of interest, and then they can develop the insight that which syrup needs to be chosen. Then if we are covering all these slides together, means a brief of all the presentation. The highlight of the recent NMC curriculum is the medical education, involvement of the PG in UG teaching, posting in clinical departments, district residency program, ACLS, BCLS training. I have given the details. Participation in national workshop, paper and poster presentation, BCPR cycle training, GCP training. We have suggested that we need to modify teaching and learning method by being adopted by pharmacology department. We need to modify our method of assessment. Some of our examples have been discussed. Professional exposure to computer and internet during the learning process. Industry, clinical research posting is giving a lot of exposure. Sessions on correlation of pharmacology therapeutics and exposure to clinical practice. I have taken major reference from this document that is available online on the NMC website. These are the guidelines they have came up with the true. And these guidelines now are a part of your curriculum also. Means my entire presentation is a part of your curriculum. It is mentioned. And with these words, I can want to express my sincere gratitude to all my elders and to all my senior faculty members who are standing behind me like a pillar of support all the time for making our dream come into reality. With these words, I want to thank you all. The house is open for the
Thank you, Dr. Kamaal. The gist of whole talk is that we have to make the PGs holistic, and we have to assess holistically. That is the one line. That is, we have to make all the domain, cognitive, psychomotor, and all within you, as well as we have to assess you. And for that, it is good that everything is in black and white. जब हम लोग MD कर रहे थे सर, तो समुद्र था. ये समुद्र अभी भी है. बस उस समुद्र में रास्ता नहीं पता था. तो हो सकता है कि हम वहाँ पहुँचे, हो सकता है कि नहीं पहुँचे. आज आपको रास्ता पता है. Now you are knowing these steps in black and white. So just you cover these and you are there. So that's how you are. Everything is there, and we are and whole faculty and everybody is with you. And any comment, any query, any suggestion regarding to this particular talk, most welcome.
You can ask if you are having some queries in your mind.
It is better you ask here only. It is good to ask here only. Otherwise, you can ask through WhatsApp. Otherwise, it is good to ask.
And 24/7, I am available on the WhatsApp. Please don't hesitate to contact me directly on WhatsApp or making phone calls. I am available for the future of the pharmacologist all the time.
Yes.
sir, we have to PG has to publish a paper in index journal. This index journal, this should be indexed, or this should be PubMed or Scopus or like this.
They have given the separate guidelines for this registration of this indexing. That is the separate document related to that. And they have given the documenting agencies also, which agencies are accepted by the NMC. There is a separate document where you can find out index Copernicus.
Sir, there are many journals which are indexed, but they are not in the list of the approved list by the NMC.
NMC has given a clear-cut document
Five.
related to that. Okay. 5 probably I'm
So,
not able to recall.
the PG has to
Yeah.
publish the paper in
Yes,
those
yes.
journals or in other.
In these index journals, they should publish their paper. Otherwise, it is of no use.
Indexing is by multiple authorities, and some of the indexing systems are flaws actually. So
Yeah.
they are fake. So those which are fake, they have been removed from the NMC, and only the actual credited one. Now they are actually, so out of that, PubMed is there and other Scopus is there. They under these guidelines, they can publish. So with these words, if anybody, any PG, any PG, any SR,
And soon
Yes,
we,
yes.
yes, please.
Thank you, sir, for this wonderful talk. So I have two questions. One question is about the additional research project you talked about. Could you please elaborate on that? So how long, how much time it is going to take? Who is going to conduct it? And the second question is from, you said there can be postings in the pharmaceutical industry. Could you please elaborate that also? Thank you so much.
Yeah, first question answer is related to that. Separate research topics need not be that much exhaustive as your thesis is. It can be taken as a short assignment. And if your thesis topic is based on the diabetes, then you can take a short research topic related to the prescription audit. I have given the laboratory work also. So any of the topic of the area of your choice. But again, I'm giving you the hint, it is not that exhaustive that your thesis is. And second question, what was that?
Industry.
Yeah, industry, many head of the department, they are collaborating with the industry people. And now through our organizations also, we are opening the gates where we want that our students should be given direct exposure. What is happening actually in the clinical research setup in the pharmaceutical industry, what are the various jobs. So during that period, they can be taken as an internist, or they can be given any kind of the title to that. But a short period will give you the direct idea what is happening and direct experience related to the industry.
So thank you very much, Dr. Kamaal, for such a wonderful, exhaustive, and summative both. So it was pleasure to hear you, listen you, and we learned a lot. And I think most of the PGs and faculty, they must have been benefited by your talk. And now I request my HOD, Professor Ramachandra, to say a few words.
There's no doubt that Dr. C M Kamaal has done very hard work to prepare these slides for you. And now, because NMC is becoming quite serious about the teaching and training program, and we have to adapt all these things which have been shown by the NMC. And here we are planning this training program in the industry as well. So shortly we will organize this because NMC has given this guideline. So it will be easy for us to organize this. Previously it was difficult. It was to get the leave, to send the people. It was not in order. Now it will be easily. And as the number is increasing, many people have to go to the industry. Recently, the FDA has given this instruction to all the industries that they have to make a pharmacovigilance committee in their industry, was various adverse drug reactions are coming and they are not reported. Now we are trying that it should be made compulsory that MD pharmacology should be included in that, so that we can have a better employment opportunities for our postgraduates who are getting their training in the various medical colleges. I hope there's a good future and the recognition of a pharmacologist is good in the future. So work hard, make yourself ready for future challenges to come. Thank you, Dr. Kamaal, once again.
Thank you so much, sir. I now request our head of department, Professor Amol Sachan, sir, to facilitate Professor Kamaal, sir, with a token of respect and affection as a memento and certificate of honor. Thank you, sir. I invite Professor Sarvesh Singh, sir, to present a vote of thanks.
I am thankful to National Association of Pharmacology and Therapeutics for approving our request to arrange guest lecture in our department. I am thankful to our HOD sir, who on a very brief notice encouraged us to proceed for the event. And I am thankful to Dr. Kamaal for delivering a very informative lecture in a very precise